This is a development beginning to cause concern. Health officials in the state of New York are investigating 85 cases of children with an inflammatory disease possibly linked to COVID-19. Other states have also been alerted to the newly discovered symptoms in children, which can include inflammation of the heart. Here is New York Governor Andrew Cuomo.
This does not present as a normal COVID case. COVID cases tend to be respiratory. This presents as an inflammation of the blood vessels, sometimes inflammation of the heart. It's possible that these cases were coming in and were not diagnosed as related to COVID because they don't appear as COVID.
He went on to talk about an entirely different chapter of a disease. Governor Cuomo there. Let's talk now to Dr. Mike Zody, Scientific Director of Computational Biology at the New York Genome Center. Thank you very much for your time. Very glad to talk to you. What do you make of this? Do you think there is a link between this disease, Kawasaki disease, I think some call it, and COVID-19? And what is Kawasaki disease?
So Kawasaki disease or Kawasaki syndrome is an autoinflammatory autoimmune disorder that involves inflammation primarily of the blood vessels, although this causes a number of different symptoms, including fevers, rashes, and in severe cases, damage to the organs or aneurysms that can be fatal. And the reason in this case that we think that this is related to COVID is that both in New York and in other places, hospitals are reporting a significant uptick in the number of patients that are coming in with these symptoms, and many of them are testing positive either for presence of the coronavirus or for antibodies indicating that they may have had it in the past.
How worried about this are you and your colleagues? I know it's a very rare disease, but it can't just be New York, can it, alone? There must be other cases which are perhaps not being spotted yet.
That's correct. When you look at the number of cases in total that we have in New York and the number of cases of this severe syndrome that we're seeing in children, it's likely that other places that have fewer cases probably have fewer instances of the childhood syndrome as well, and may not be recognizing it as being COVID related, since Kawasaki itself occurs at some low rate in the background.
Now, you have a study I know you're undertaking with New York State and the Rockefeller Center. What do you expect to find? How concerned in general are you about this?
So in terms of concern level, I think obviously because it's a severe repercussion and it's in a population that hasn't been hit particularly hard by this disease so far, that is children, I think it's very important from a public health perspective that we understand how likely this is to be a severe problem when we think about the probability that there will be more children who are infected with COVID in the future. And so we know from Kawasaki in general that there's a genetic component to it, and what we're hoping is to understand if we can figure out who's at risk for this due to genetics, and whether that gives us some insight into the way the virus is interacting with the body's immune system that might help us both treat these patients, but more generally to understand treatment of COVID.
I have to ask you to answer this briefly. I know it's unfair to ask you for a brief answer, but parents have been thinking COVID-19, well, it seems to cause only mild symptoms in children, but parents everywhere hearing you talk about this will be freaking out. Should they be?
I don't think they should be freaking out, but I think they should be concerned. And I think that they should look for symptoms that seem severe but atypical for COVID. Fever that lasts a very long time without any respiratory symptoms that might be indicative of this. And I think that they should be concerned if their children have had COVID and then have an apparent secondary illness after they think they're over the respiratory symptoms.
In which case, get the kids to hospital as fast as possible?
I think in which case they should contact their doctor and ask them what to do. I don't know that I would recommend that everyone who has concern rush to the hospital right away.
Dr. Mike Zody, thank you so much.